Do you seed cycle to balance your hormones and possibly improve your fertility and egg quality? Well, if you do or you don't have a clue what seed cycling is, I'm going to go ahead and discuss what seed cycling is and break down the theory as to the benefits for your hormone and your fertility. I'm Susanna Pueyes, and I'm an integrative medical provider. I'm an acupuncturist, herbalist, and nutritionist, and I help women like you feel energized, get into head turning shape, overcome those hormone imbalances, and boost your fertility at any age. So seed cycling is based off of your monthly menstrual cycles, which are broken up into two phases, the follicular and the luteal. The follicular phase is day 1 of your period to day 14 or 15. That's based off of a 28 or 30-day menstrual calendar. So follicular, day 1 to day 15, is when the follicles in the ovaries are maturing so that you can get that golden ripe egg at ovulation. If you're trying to get pregnant, that's what we want. Then you ovulate, and then we switch into the luteal phase. The next 2 weeks of your cycle are called the luteal phase, where progesterone is supposed to rise so that you can get pregnant. And if you don't, you have a period. That's called the luteal phase. And then if you do get a period, day 1, you're back in follicular. So seed cycling uses the cycles of how your hormones flux, go up and down. During the follicular phase, it's theorized to eat 1 tablespoon of ground flaxseed and 1 tablespoon of ground pumpkin seeds. Why these? Because they are said to have a lot of phytoestrogen nutrients. During the follicular phase, we want to build the yin, build the estrogen, make those follicles grow. That's what gives you the cervical mucus, that liquid. That's estrogen. Your face gets better, your creativity heightens, your libido heightens. That's estrogen. So we want more of that good estrogen. And there are foods that are phytoestrogenic. Those seeds in particular are that help to produce that, or help your body produce more of it, better quantities at ovulation. Then you ovulate, and then you switch to taking 1 tablespoon of ground sesame seeds, 1 tablespoon of sunflower seeds. These are high in a phytonutrient called lignans, and lignans help to block or inhibit estrogen. Okay, and this is important during the luteal phase because we want to increase progesterone during this time. So it's not that we don't ever want phytoestrogens, but during this phase, we want to prioritize progesterone. And so most of us are estrogen dominant during this phase, so this is a good theory. And so the sunflower and the sesame seeds have high lignans, so it inhibits estrogen so that progesterone can get higher relative to estrogen. And that is the theory behind seed cycling, to boost your hormones. Now, as a clinician, sometimes I want to see evidence. I've had many patients try this on their own. A lot of them are not consistent because 2 tablespoons every single day for a couple of months is a lot. And when we are doing food-based medicine or herbal-based medicine, you always have to remember, give it a minimum of 3 months before we start to see radical changes. If it happens before, that's even better, but we have to give the body some time and some grace. You can do this, but give it some time if you don't see initial results. So honestly, I looked into evidence-based tips about this, and there's not a lot of research on it. And it could be because the big pharma-based medical industry, they choose what they want to research because most likely it's attached to a drug, a medication that's coming out to market that they want to see results for. Because it's food, there's not a lot of research or evidence-based on research and nutrition for health, because you really can't patent it, and you really can't benefit from, you can't really sell and patent flax seeds, for example, or broccoli. So in terms of research, it's not there. But because I'm a holistic provider and I've seen many patients defy doctors, you know, doctors, theories on what doesn't work and what doesn't. I believe there is no harm in increasing your seeds, your nut intake, because flax seeds and all of these other seeds that you may use for seed cycling and others like nuts, like especially walnuts and Brazil nuts, are super beneficial to your health. And we know that for sure. What I did find is that a single teaspoon of ground flaxseed every day gives you the daily production of lignans. Remember lignans, they are a phytonutrient, an antioxidant that helps prevent breast cancer and prostate cancer. And in clinical trials, it helped to reduce tumor growth in just a couple of months. That is evidence. That is people with cancer. There's a lot of money behind that study. So because I didn't find it for seed cycling to balance hormones doesn't mean it doesn't work, okay? And there is this study that does show that this phytoestrogenic and phytonutrient flax seeds help to prevent and detour breast cancer and decrease tumor growth. That's awesome. Not only that, you have to look at everything. So all these seeds and nuts, good fats, omega-3 fatty acids, they help to reduce inflammation. They help to balance your blood sugar, and their blood sugar is a hormone, insulin. So that balances insulin and cortisol. So it's all a revolving door. So there's nothing wrong with increasing your seeds. In fact, sunflower and pumpkin seeds are very high in zinc. So zinc, you need a lot of it for your immune system. But if you're trying to get pregnant and improve your egg quality and definitely your sperm quality, you need a lot of zinc. You may have metals and toxins that are blocking the reception of zinc in your ovaries and the sperm, but you need a lot of zinc to produce good egg and sperm quality. And so pumpkin seeds and sunflower seeds are a really, really great nutritional way to get those in every single day without harm. And I say that because a lot of people go to like a zinc tablet or a zinc supplement, and use food first, because you are getting not only the zinc in the seeds, but all of these other minerals and bioavailable flavonoids and nutrients and fats and all of these things that help balance out what just a zinc supplement can do harm in the long run, because it's not natural. It's not natural. That's not how the body works. Okay. So in the end, increasing your seed and nut intake for your overall health can balance your hormones, can improve your egg quality and sperm quality if that's an issue. It can improve mood because it balances blood sugar. And you should be eating a handful of nuts and seeds every day for the omega-3 fatty acids that just not only balance your hormone, but balance your brain function and your skin. So in the end, seed cycle, eat some seeds, eat some good, healthy fats from plant-based sources first and foremost, so that you can digest it and make the most of it. Take care.